Question 1. The evaluation methodology shows a certified orthopedic nurse assessing a patient presenting with joint pain, stiffness, and reduced range of motion. The nurse must differentiate between the primary pathophysiological mechanisms of osteoarthritis and rheumatoid arthritis to guide appropriate nursing interventions. Which of the following approaches best reflects a deep understanding of the pathophysiology of these conditions for effective patient management? Option A. Focusing on the common symptom of joint pain and stiffness in both conditions, and implementing general comfort measures and range of motion exercises without specific consideration for the underlying disease process. Option B. Prioritizing the assessment of systemic inflammatory markers and extra-articular manifestations, which are more prominent in rheumatoid arthritis, and applying interventions typically used for inflammatory arthropathies to the patient, regardless of the specific diagnosis. Option C. Emphasizing the role of mechanical wear and tear as the sole cause of joint dysfunction, and recommending rest and activity modification as the primary intervention for all joint-related complaints. Option D. Identifying the degenerative changes in articular cartilage and subchondral bone characteristic of osteoarthritis, and contrasting this with the autoimmune inflammatory process affecting the synovial membrane in rheumatoid arthritis to tailor pain management and joint protection strategies. Correct answer is D. Identifying the degenerative changes in articular cartilage and subchondral bone characteristic of osteoarthritis, and contrasting this with the autoimmune inflammatory process affecting the synovial membrane in rheumatoid arthritis to tailor pain management and joint protection strategies. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified orthopedic nurse to differentiate between the underlying pathophysiological processes of two distinct but commonly co-occurring musculoskeletal conditions. Misinterpreting the primary pathology can lead to inappropriate nursing interventions, delayed or incorrect treatment, and ultimately, suboptimal patient outcomes. The nurse must apply a deep understanding of cellular and tissue-level changes to accurately assess the patient's condition and guide care. Correct approach analysis. The correct approach represents best professional practice because it demonstrates the nurse's ability to accurately identify the primary pathophysiological mechanism driving the patient's symptoms. This accurate identification is crucial for developing an effective, evidence-based care plan. For example, understanding that osteoarthritis involves degenerative changes in articular cartilage and subchondral bone, while rheumatoid arthritis is an autoimmune inflammatory process affecting the synovial membrane, dictates different nursing priorities, such as pain management strategies, joint protection techniques, and patient education regarding disease progression and management. This aligns with the ethical principle of beneficence, ensuring the patient receives care tailored to their specific condition and the professional standard of competent practice. Incorrect approaches analysis. An incorrect approach, such as focusing solely on symptom management without understanding the underlying pathophysiology, represents a failure to provide comprehensive and targeted care. This could lead to masking symptoms without addressing the root cause, potentially allowing the disease to progress unchecked. Ethically, this could be viewed as a breach of the duty of care, as it fails to meet the patient's needs at a fundamental level. Another incorrect approach, such as applying interventions for one condition to a patient with the other, is a direct violation of professional standards and potentially regulatory guidelines that mandate evidence-based practice. This could result in ineffective treatment, patient harm, and a failure to adhere to the scope of practice for a certified orthopedic nurse. It demonstrates a lack of critical thinking and diagnostic reasoning, which are essential for safe and effective patient care. Professional reasoning. Professionals should approach patient assessment by first gathering a comprehensive history and performing a thorough physical examination. This should be followed by a critical analysis of the patient's signs and symptoms in the context of known musculoskeletal pathologies. The nurse should then consult relevant, current evidence-based literature and practice guidelines to confirm the most likely diagnosis and understand the specific pathophysiological processes involved. This analytical process allows for the selection of the most appropriate nursing interventions that directly address the identified pathology and its consequences, ensuring patient safety and optimal outcomes. Question 2. The assessment process reveals that a patient scheduled for a comprehensive orthopedic evaluation is experiencing significant pain when attempting to move their affected limb through its full range of motion and during initial attempts at strength testing. The patient expresses a strong desire to avoid further movement due to the discomfort. As a certified orthopedic nurse, how should you proceed to ensure both patient comfort and the collection of necessary functional data? Option A. Proceed with the full range of motion and strength testing as per protocol, instructing the patient to tolerate the pain as it is necessary for accurate assessment. Option B. Administer a prescribed analgesic immediately and then proceed with the full assessment without further discussion, assuming the medication will alleviate the pain sufficiently. Option C. Immediately cease all range of motion and strength testing and document that the patient refused the assessment due to pain, without further attempts to modify the evaluation. Option D. Gently explain the importance of the assessment for their treatment plan, explore alternative positions or slower movements to minimize pain, and offer to pause and reassess the pain level before continuing, ensuring the patient feels heard and involved in the process. The correct answer is D. Gently explain the importance of the assessment for their treatment plan, explore alternative positions or slower movements to minimize pain, and offer to pause and reassess the pain level before continuing, ensuring the patient feels heard and involved in the process. Explanation. Scenario analysis. This scenario presents a professional challenge where a certified orthopedic nurse must balance the patient's expressed discomfort with the objective need for a comprehensive functional assessment. The ethical dilemma lies in respecting patient autonomy and comfort, while fulfilling professional responsibilities to gather accurate data for effective treatment planning. The nurse must navigate potential conflicts between patient preference and clinical necessity, ensuring the patient's well-being and dignity are paramount. Correct approach analysis. The correct approach prioritizes patient comfort and safety while still aiming to achieve a meaningful assessment. This involves clear communication, education about the importance of the assessment, and employing strategies to minimize discomfort, such as gradual movement or alternative positioning if feasible. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as professional standards for patient-centered care. The nurse's role is to facilitate the assessment in a way that is both effective and humane, respecting the patient's experience. Incorrect approaches analysis. One incorrect approach would be to proceed with the full range of motion and strength testing without adequately addressing the patient's stated pain. This could be interpreted as a failure to respect patient autonomy and a potential violation of the principle of non-maleficence, as it could exacerbate pain and distress. It might also contravene guidelines that emphasize patient comfort and the need for informed consent, even for routine procedures. Another incorrect approach would be to abandon the functional assessment entirely based solely on the patient's initial expression of pain, without attempting any modifications or further communication. This could lead to an incomplete or inaccurate assessment, potentially hindering the development of an appropriate care plan and failing to meet the professional obligation to gather necessary clinical data. This approach might also be seen as a lack of professional diligence and a failure to explore all reasonable options for assessment. A third incorrect approach would be to administer pain medication without a clear order or assessment of the pain's origin and severity, or to proceed with the assessment immediately after administering medication without allowing it time to take effect. This could lead to medication errors, mask underlying issues, or result in an inaccurate assessment due to the medication's influence. It also bypasses the critical step of understanding the nature and impact of the patient's pain. Professional reasoning. When faced with a patient expressing pain during a functional assessment, a certified orthopedic nurse should employ a systematic decision-making process. This involves 1. Active listening and validation of the patient's experience. 2. Further assessment of the pain, location, intensity, quality, aggravating/alleviating factors. 3. Clear explanation of the purpose and importance of the assessment and how it informs their care. 4. Exploration of modifications to the assessment to improve comfort, e.g., slower movement, different positions, breaks. 5. Consultation with the physician or advanced practice provider if pain is severe, persistent, or significantly impedes the assessment. 6. Documentation of the patient's report, the nurse's actions, and the rationale for any modifications or decisions. This process ensures patient safety, promotes trust, and upholds professional standards for comprehensive and compassionate care. Question 3. The investigation demonstrates a patient presenting with acute, localized pain in the posterior aspect of the knee, accompanied by swelling and a palpable mass. The patient reports a recent history of strenuous physical activity. Considering the anatomy and physiology of the knee joint, which of the following risk assessment approaches best guides the orthopedic nurse's evaluation? Option A. Administer a broad-spectrum antibiotic to prevent potential infection of the swelling. Option B. Assess for signs of venous thromboembolism and initiate anticoagulant therapy if indicated. Option C. Perform a detailed palpation of the popliteal fossa, evaluating for tenderness, size, and consistency of any mass, and assess range of motion and neurovascular status distal to the knee. Option D. Focus on pain management strategies and advise the patient on rest and elevation without further diagnostic investigation. The correct answer is B. Assess for signs of venous thromboembolism and initiate anticoagulant therapy if indicated. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified orthopedic nurse to interpret complex anatomical and physiological information in the context of a patient's presenting symptoms and potential underlying pathology. The nurse must move beyond simple identification of structures to understanding their functional relationships and how disruptions in these relationships manifest as clinical signs and symptoms. This demands a high level of critical thinking and the ability to synthesize information from multiple sources, including patient history, physical examination findings, and diagnostic imaging, all while adhering to the strict regulatory framework governing orthopedic nursing practice. Correct approach analysis. The correct approach involves a systematic assessment of the patient's musculoskeletal system, focusing on the specific anatomical structures and physiological processes implicated by the presenting symptoms. This aligns with best professional practice by ensuring a comprehensive and evidence-based evaluation. Regulatory frameworks for orthopedic nursing emphasize the importance of accurate patient assessment, the application of specialized knowledge, and the development of appropriate care plans based on a thorough understanding of musculoskeletal anatomy and physiology. This approach prioritizes patient safety and optimal outcomes by identifying the root cause of the patient's distress. Incorrect approach is analysis, an approach that focuses solely on superficial observation without considering the underlying biomechanics or nerve pathways would be a regulatory and ethical failure. It neglects the core principles of orthopedic nursing, which require a deep understanding of how bones, joints, muscles, and nerves interact. This superficial assessment could lead to misdiagnosis, delayed treatment, and potentially iatrogenic harm, violating the nurse's duty of care and professional standards. An approach that prioritizes patient comfort measures without a concurrent diagnostic assessment of the musculoskeletal system's integrity is also professionally unacceptable. While pain management is crucial, it should not supersede the imperative to identify and address the underlying anatomical or physiological dysfunction. This failure to investigate the cause of the pain could result in the progression of a serious orthopedic condition, contravening the regulatory requirement for comprehensive patient care and potentially leading to adverse patient outcomes. An approach that relies on anecdotal evidence or the experiences of other patients, rather than a systematic, evidence-based assessment of the current patient's musculoskeletal status, represents a significant ethical and regulatory lapse. Professional nursing practice is grounded in scientific principles and established clinical guidelines. Deviation from this standard risks providing substandard care, which could have serious consequences for the patient and expose the nurse to disciplinary action for failing to meet professional competency. Professional reasoning. Professionals should approach such situations by first activating their knowledge base of musculoskeletal anatomy and physiology. This involves recalling the structure and function of bones, joints, ligaments, tendons, muscles, and nerves relevant to the patient's reported symptoms. Next, they should correlate these anatomical and physiological principles with the patient's subjective complaints and objective findings from the physical examination. This systematic correlation allows for the generation of differential diagnoses. The process then involves utilizing diagnostic tools, e.g., imaging, laboratory tests, to confirm or refute these hypotheses, guided by the initial assessment. Finally, the nurse must integrate all gathered information to formulate an effective, individualized care plan that addresses the identified musculoskeletal issue, always within the scope of practice and regulatory guidelines. Question 4. Market research demonstrates that orthopedic patients often experience significant post-operative pain requiring careful management. A patient recovering from a total knee arthroplasty reports moderate to severe pain, rated 7/10, with functional limitations. The patient has no history of substance abuse, but expresses anxiety about pain control. Which of the following pain management strategies best aligns with current regulatory frameworks and best practices for orthopedic pain management in the United States? Option A. Prescribe a high dose of a long-acting opioid to ensure consistent pain relief throughout the recovery period, with minimal emphasis on non-opioid adjuncts. Option B. Initiate a multimodal pain regimen including scheduled acetaminophen and a short-acting opioid, with a plan to titrate the opioid based on pain scores and incorporate adjuvant medications like gabapentin to address neuropathic components, alongside patient education on safe opioid use and non-pharmacological comfort measures. Option C. Administer a single dose of a strong opioid and then rely solely on non-pharmacological interventions such as ice and physical therapy for ongoing pain management. Option D. Immediately discontinue all opioid analgesics and focus exclusively on over-the-counter pain relievers and distraction techniques, given the patient's anxiety. The correct answer is B. Initiate a multimodal pain regimen including scheduled acetaminophen and a short-acting opioid, with a plan to titrate the opioid based on pain scores and incorporate adjuvant medications like gabapentin to address neuropathic components, alongside patient education on safe opioid use and non-pharmacological comfort measures. Explanation: this scenario is professionally challenging due to the inherent risks associated with opioid analgesia, including the potential for dependence, overdose, and diversion, alongside the complex needs of orthopedic patients experiencing significant post-operative pain. Balancing effective pain relief with patient safety and adherence to regulatory guidelines requires meticulous assessment and individualized care planning. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal pain management strategy that aligns with current evidence-based guidelines and regulatory frameworks governing controlled substances. This approach emphasizes a thorough patient assessment to identify pain characteristics, contributing factors, and individual risk profiles for opioid-related adverse events. It advocates for the judicious use of opioids, starting with the lowest effective dose and shortest duration, and actively incorporating adjuvant medications to enhance analgesia and reduce opioid requirements. This aligns with the principles of responsible prescribing, patient education on safe medication use and storage, and ongoing monitoring for efficacy and adverse effects, all of which are critical for patient safety and regulatory compliance in the United States. An incorrect approach that solely relies on escalating opioid doses without considering non-opioid alternatives or adjuvant medications fails to adhere to the principles of judicious opioid prescribing and patient safety. This could lead to increased risk of opioid-induced respiratory depression, constipation, and long-term dependence, potentially violating patient care standards and guidelines from organizations like the Centers for Disease Control and Prevention, CDC, on opioid prescribing. Another incorrect approach that prematurely discontinues all opioid analgesia without adequate assessment of the patient's pain and functional status, or without providing appropriate alternative pain management strategies, could result in undertreated pain, patient distress, and functional impairment. This neglects the professional obligation to provide effective pain relief and could be seen as a failure to meet the patient's needs, potentially leading to negative patient outcomes and dissatisfaction. A further incorrect approach that focuses exclusively on non-pharmacological interventions while neglecting the patient's reported pain severity and the established efficacy of pharmacological agents for moderate to severe orthopedic pain fails to provide a balanced and evidence-based pain management plan. While non-pharmacological methods are valuable adjuncts, they may not be sufficient as a sole strategy for significant post-operative orthopedic pain, leading to inadequate pain control and patient suffering. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive pain assessment. Evaluate pain intensity, location, quality, duration, and factors influencing it. 2. Risk stratification. Assess patients' history of substance use, mental health conditions, and other factors that may increase the risk of adverse opioid-related events. 3. Multimodal strategy development. Integrate pharmacological opioids, adjuvants, and non-pharmacological interventions tailored to the individual patient. 4. Individualized treatment plan. Select medications based on pain type, severity, and patient-specific factors, starting with the lowest effective dose and shortest duration for opioids. 5. Patient education. Instruct on safe medication use, storage, disposal, and potential side effects. 6. Ongoing monitoring and reassessment. Regularly evaluate pain control, functional status, and for signs of adverse effects or opioid misuse. 7. Documentation. Maintain thorough records of assessments, treatment plans, and patient responses. 8. Adherence to regulations. Ensure all prescribing and dispensing practices comply with federal and state controlled substance laws and professional guidelines. Question 5. Performance analysis shows that a certified orthopedic nurse is educating a patient recovering from a knee injury. The nurse needs to explain the distinct roles of different connective tissues within the knee joint to ensure proper rehabilitation and prevent future injury. Which of the following explanations most accurately differentiates the primary functions of ligaments and articular cartilage in this context? Option A. Ligaments are primarily responsible for absorbing shock and reducing friction between the bones within the joint, while articular cartilage provides stability by connecting the bones. Option B. Ligaments are primarily responsible for stabilizing the joint and limiting excessive movement, while articular cartilage's main function is to reduce friction and absorb shock within the joint surfaces. Option C. Both ligaments and articular cartilage primarily function to connect bones together, with their differences lying mainly in their elasticity and tensile strength. Option D. Articular cartilage's main role is to limit excessive joint movement and connect bones, whereas ligaments are crucial for reducing friction and absorbing impact during motion. The correct answer is A. Ligaments are primarily responsible for absorbing shock and reducing friction between the bones within the joint, while articular cartilage provides stability by connecting the bones. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified orthopedic nurse to differentiate between the functional and structural integrity of two distinct but related connective tissues, ligaments and cartilage, in the context of patient education and care planning. Misunderstanding the specific roles and vulnerabilities of each tissue can lead to inappropriate patient advice, delayed or incorrect treatment, and ultimately, suboptimal patient outcomes. The nurse must apply a nuanced understanding of orthopedic principles within the scope of practice defined by relevant nursing regulations and organizational policies. Correct approach analysis. The correct approach demonstrates best professional practice by accurately distinguishing between the primary functions of ligaments, stabilization, and limiting excessive movement, and articular cartilage, reducing friction and absorbing shock within a joint. This accurate understanding is crucial for providing evidence-based patient education regarding injury prevention, rehabilitation protocols, and the long-term implications of specific orthopedic conditions. Adherence to the scope of practice for a certified orthopedic nurse, as defined by professional standards and regulatory bodies, mandates this level of precise knowledge. This approach aligns with the ethical principle of beneficence, ensuring the patient receives accurate and helpful information. Incorrect approach is analysis, an approach that conflates the roles of ligaments and cartilage by suggesting that cartilage primarily provides joint stability, is incorrect. This reflects a fundamental misunderstanding of biomechanics and the distinct roles of these tissues. Ethically, providing such misinformation violates the principle of non-maleficence, as it could lead to patient actions that exacerbate existing conditions or lead to new injuries. From a regulatory perspective, practicing outside the bounds of established orthopedic knowledge can be considered a breach of professional competence. Another incorrect approach might be to focus solely on the inflammatory response common to injuries of both tissues, without differentiating their specific structural damage or functional impairment. While inflammation is a shared characteristic, it does not address the unique pathology of ligamentous tears versus cartilage degeneration or tears. This oversimplification fails to provide the patient with the specific information needed for targeted management and recovery, potentially leading to ineffective treatment strategies and a violation of the duty to provide competent care. A third incorrect approach could be to attribute the primary cause of joint stiffness solely to ligamentous laxity, ignoring the significant role of cartilage damage or inflammation in restricting joint movement. This demonstrates a lack of comprehensive understanding of joint mechanics and pathology. Providing advice based on this incomplete understanding could lead to inappropriate therapeutic interventions and a failure to address the root cause of the patient's stiffness, thereby failing to uphold the standard of care expected of a certified orthopedic nurse. Professional reasoning. When faced with a scenario requiring differentiation between connective tissues, a certified orthopedic nurse should employ a systematic decision-making process. This involves 1. Activating foundational orthopedic knowledge regarding the anatomy and physiology of ligaments, tendons, and cartilage. 2. Consulting current, evidence-based clinical guidelines and literature specific to orthopedic nursing practice. 3. Considering the patient's specific presentation and history to tailor the assessment and education. 4. Communicating clearly and accurately, ensuring patient comprehension and adherence to treatment plans. 5. Adhering strictly to the established scope of practice and regulatory requirements for orthopedic nursing. Question 6. The control framework reveals that a certified orthopedic nurse is managing the rehabilitation of a patient who underwent a total knee arthroplasty. The patient reports persistent stiffness and pain that limits their range of motion, despite adhering to the prescribed exercises. The nurse is considering adjusting the rehabilitation protocol. Which of the following approaches best reflects a comprehensive and compliant strategy for managing this patient's rehabilitation? Option A. Implement a modified exercise regimen that gradually increases intensity and range of motion, incorporating pain management strategies and seeking consultation with the physical therapist to reassess the patient's functional goals and progress. Option B. Continue with the original postoperative exercise protocol as prescribed by the surgeon, assuming the patient will eventually adapt and improve with time. Option C. Advise the patient to significantly reduce their activity level and avoid any exercises that cause discomfort, prioritizing rest to prevent further irritation. Option D. Focus solely on pain relief measures, such as increased medication, to improve patient comfort and postpone further therapeutic exercises until the pain subsides completely. The correct answer is A. Implement a modified exercise regimen that gradually increases intensity and range of motion, incorporating pain management strategies and seeking consultation with the physical therapist to reassess the patient's functional goals and progress. Explanation. The scenario presents a common challenge in orthopedic nursing, tailoring rehabilitation protocols to individual patient needs while adhering to established best practices and regulatory guidelines. The complexity arises from the need to balance the patient's subjective experience and functional goals with objective clinical findings and evidence-based rehabilitation principles. Professional judgment is paramount in assessing the patient's progress, identifying potential barriers to recovery, and adapting the treatment plan accordingly. The correct approach represents best professional practice because it prioritizes a holistic, patient-centered, and evidence-based methodology. This involves a comprehensive assessment that considers the patient's specific orthopedic condition, surgical intervention, functional limitations, and personal goals. It emphasizes collaboration with the patient and the interdisciplinary team, ensuring that physical and occupational therapy interventions are integrated and progress is monitored systematically. This aligns with regulatory frameworks that mandate individualized care plans, patient safety, and the promotion of optimal functional outcomes. Ethical considerations, such as patient autonomy and beneficence, are upheld by actively involving the patient in decision-making and striving for the best possible recovery. An incorrect approach that relies solely on a standardized, one-size-fits-all protocol fails to acknowledge the unique biological and psychosocial factors influencing each patient's recovery. This can lead to suboptimal outcomes, patient dissatisfaction, and potentially delayed or incomplete rehabilitation. Regulatory or ethical failures in this instance would include a breach of the duty to provide individualized care and a potential violation of patient rights to receive appropriate and effective treatment. Another incorrect approach that focuses exclusively on the surgeon's initial postoperative orders without reassessment or adaptation ignores the dynamic nature of healing and rehabilitation. This can result in the patient being pushed too hard too soon, risking re-injury, or conversely, being held back unnecessarily, prolonging recovery. This approach demonstrates a lack of clinical judgment and a failure to respond to the patient's evolving needs, which could be considered a deviation from professional standards of care and potentially a regulatory concern regarding patient safety and quality of care. A third incorrect approach that prioritizes patient comfort above all else, without adequately challenging them to achieve functional milestones, can lead to a prolonged period of dependence and reduced long-term functional capacity. While patient comfort is important, it should not supersede the goal of maximizing independence and restoring function. This approach may fall short of the professional obligation to promote patient recovery and could be seen as a failure to adhere to evidence-based rehabilitation principles, potentially impacting the patient's quality of life and increasing healthcare utilization. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Gather all relevant data, including patient history, physical examination, imaging, and patient-reported outcomes. 2. Goal setting. Collaboratively establish realistic, measurable, achievable, relevant, and time-bound SMART goals with the patient. 3. Intervention planning. Develop an individualized rehabilitation plan incorporating evidence-based physical and occupational therapy interventions. 4. Monitoring and evaluation. Continuously assess the patient's progress, response to interventions, and any emerging challenges. 5. Adaptation. Modify the rehabilitation plan as needed based on ongoing assessment and patient feedback. 6. Communication. Maintain open and clear communication with the patient, family, and the interdisciplinary team. This iterative process ensures that care remains aligned with the patient's needs and best practice standards. Question 7. System analysis indicates that a patient recovering from lumbar spinal fusion surgery presents with new-onset weakness in dorsiflexion of the left foot, resulting in foot drop. The orthopedic nurse is tasked with initial assessment. Which of the following assessment strategies best reflects an understanding of neuroanatomy related to musculoskeletal function in this context? Option A. Administer a prescribed muscle relaxant to alleviate any potential spasms contributing to the foot drop. Option B. Elevate the patient's leg and apply a cold compress to the affected limb to reduce inflammation. Option C. Perform a detailed neurological examination focusing on sensory and motor function of the lower extremities, specifically testing ankle dorsiflexion strength and reflexes, and inquire about any new paresthesias. Option D. Assess the surgical incision for signs of infection and palpate the calf muscles for tenderness. The correct answer is D. Assess the surgical incision for signs of infection and palpate the calf muscles for tenderness. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of neuroanatomy in orthopedic nursing. A patient experiencing new-onset foot drop after spinal surgery requires immediate and accurate assessment. The orthopedic nurse must integrate knowledge of the nervous system's role in musculoskeletal function with post-operative care protocols. Failure to correctly identify the neurological origin of the foot drop can lead to delayed or inappropriate interventions, potentially exacerbating the patient's condition and impacting recovery. The challenge lies in differentiating between a direct surgical complication affecting neural pathways and other potential post-operative issues, demanding a nuanced understanding of neuroanatomy. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes identifying the specific nerve pathway affected. This aligns with best professional practice by ensuring that interventions are targeted and evidence-based. Specifically, understanding the innervation of the muscles responsible for dorsiflexion e.g., tibialis anterior and the corresponding nerve roots e.g., L4, L5, S1 or peripheral nerves e.g., common peroneal nerve is crucial. This detailed neuroanatomical knowledge allows the nurse to hypothesize the location of the neurological deficit, guiding further diagnostic steps such as neurological examination and potentially imaging. This approach is ethically sound, as it promotes patient safety and optimal outcomes by ensuring accurate diagnosis and timely, appropriate management. Regulatory frameworks for orthopedic nursing emphasize the importance of comprehensive patient assessment and the application of specialized knowledge to identify and manage complications. Incorrect approaches analysis. One incorrect approach would be to solely focus on the orthopedic aspect, such as checking surgical site integrity or cast tightness, without considering the neurological implications. This fails to acknowledge the neuroanatomy related to musculoskeletal function and could lead to overlooking a critical neurological issue. Ethically, this represents a failure to provide comprehensive care and could violate standards of practice that require a holistic patient assessment. Regulatory failure would stem from not adhering to the expected level of clinical judgment and diagnostic reasoning for an orthopedic nurse. Another incorrect approach would be to immediately administer pain medication without a thorough neurological assessment. While pain management is important, it can mask neurological deficits. This approach prioritizes symptom management over diagnosis, which is contrary to best practices in identifying the root cause of new postoperative symptoms. This could lead to a delayed diagnosis of nerve compromise, potentially resulting in permanent functional impairment, a significant ethical breach. A third incorrect approach would be to assume the foot drop is a temporary, expected side effect of surgery without further investigation. This dismisses the potential for serious complications and fails to apply critical thinking skills. It neglects the nurse's responsibility to monitor for and report significant changes in a patient's condition, which is a core tenet of professional nursing practice and regulatory expectations. Professional reasoning. Professionals should approach such situations by first activating their knowledge base regarding neuroanatomy and its direct impact on musculoskeletal function. This involves recalling the specific nerves and spinal segments responsible for the affected movements. Next, they should employ a systematic assessment framework, starting with a focused neurological examination to pinpoint the deficit. This should be followed by a review of the patient's surgical history and any immediate post-operative events. Collaboration with the surgical team and other specialists, e.g., neurologists, is essential if the initial assessment suggests a complex neurological issue. Documentation of all findings and interventions is paramount for continuity of care and legal protection. Question 8. The efficiency study reveals that a new protocol for managing opioid-induced constipation, OIC, in orthopedic patients has been implemented on your unit. A patient recovering from hip replacement surgery is experiencing significant constipation, which is impacting their pain management and mobility. The physician has prescribed a standard opioid analgesic. Which of the following approaches best reflects current best practices and regulatory expectations for managing this patient's OIC? Option A. Administer an additional dose of the prescribed opioid analgesic to help the patient relax and potentially alleviate the constipation. Option B. Discontinue the opioid analgesic immediately and inform the patient that they will need to manage their pain without it until their constipation resolves. Option C. Initiate a bowel regimen that includes a stimulant laxative and a stool softener, while closely monitoring the patient's response and consulting with the physician if symptoms do not improve within 24-48 hours. Option D. Prescribe a peripherally acting mu-opioid receptor antagonist, PAMORA, as per the unit's standing order for OIC, without further patient-specific assessment. The correct answer is C. Initiate a bowel regimen that includes a stimulant laxative and a stool softener, while closely monitoring the patient's response and consulting with the physician if symptoms do not improve within 24-48 hours. Explanation. The efficiency study reveals that a new protocol for managing opioid-induced constipation, OIC, in orthopedic patients has been implemented on your unit. This scenario is professionally challenging because OIC significantly impacts patient comfort, recovery, and can lead to serious complications, necessitating prompt and effective management. Orthopedic patients often have pre-existing comorbidities and are on multiple medications, increasing the complexity of pharmacological interventions. Careful judgment is required to select the most appropriate pharmacological approach based on individual patient factors, potential drug interactions, and adherence to evidence-based guidelines and regulatory requirements for pain and symptom management. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's current OIC severity, underlying causes, and individual risk factors before initiating or adjusting pharmacological therapy. This aligns with the principles of patient-centered care and evidence-based practice, ensuring that interventions are tailored to the patient's specific needs and medical history. Adherence to established clinical practice guidelines for OIC management, which are often informed by regulatory bodies and professional organizations, is crucial for optimizing patient outcomes and minimizing adverse events. This approach also involves ongoing monitoring and evaluation of treatment effectiveness and patient tolerance, allowing for timely adjustments to the therapeutic regimen. An incorrect approach that involves solely relying on a standing order for a specific laxative without a thorough patient assessment is professionally unacceptable. This fails to account for the patient's unique physiological status, potential contraindications, or the possibility that the chosen laxative may be ineffective or cause adverse effects in that individual. This could violate ethical principles of beneficence and non-maleficence by potentially exposing the patient to unnecessary risks or ineffective treatment. Furthermore, it may contravene regulatory guidelines that mandate individualized patient care and the use of evidence-based interventions. Another incorrect approach, such as administering a stronger opioid analgesic to mask the constipation symptoms, is a significant regulatory and ethical failure. This directly contradicts the goal of managing OIC and exacerbates the underlying problem, potentially leading to opioid toxicity and further complications. It demonstrates a profound misunderstanding of pain management principles and OIC treatment, violating professional standards of care and potentially leading to patient harm. This approach would be considered a breach of professional responsibility and could have serious legal and disciplinary consequences. A third incorrect approach, which is to discontinue all pain medication without consulting the physician or a pain management specialist, is also professionally unacceptable. While reducing opioid burden is a consideration, abrupt cessation can lead to uncontrolled pain, impacting the patient's ability to participate in physical therapy and hindering their orthopedic recovery. This decision bypasses established protocols for medication management and patient safety, potentially violating regulatory requirements for appropriate pain management and physician oversight. It also fails to address the patient's immediate need for pain relief and symptom management. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive patient assessment. Gather detailed information about the patient's pain, constipation, medical history, current medications, and any contributing factors. 2. Evidence-based practice review. Consult current clinical practice guidelines and relevant literature for OIC management in orthopedic patients. 3. Physician collaboration. Communicate findings and proposed interventions with the prescribing physician, seeking their input and orders. 4. Individualized treatment plan. Develop a plan that considers the patient's specific needs, potential drug interactions, and contraindications. 5. Patient education and engagement. Inform the patient about the treatment plan, expected outcomes, and potential side effects, and involve them in decision-making. 6. Ongoing monitoring and evaluation. Regularly assess the patient's response to treatment, monitor for adverse effects, and adjust the plan as needed. 7. Documentation. Meticulously document all assessments, interventions, and patient responses. Question 9. Implementation of nursing care for a pediatric patient diagnosed with congenital scoliosis and a separate diagnosis of idiopathic clubfoot requires a nuanced approach. Which of the following nursing strategies best reflects current best practices for managing these conditions in a pediatric orthopedic setting? Option A. Immediately advocating for surgical correction of both the congenital scoliosis and the clubfoot, as these are significant congenital anomalies that require prompt surgical intervention to prevent long-term complications. Option B. Implementing a standardized bracing protocol for all pediatric patients with congenital scoliosis and initiating a home exercise program for clubfoot without further specialist consultation based on general guidelines. Option C. Prioritizing a comprehensive assessment of the spinal curvature and foot deformity, followed by collaborative development of an individualized, evidence-based treatment plan that may include observation, bracing, physical therapy, and surgical intervention as indicated, with a strong emphasis on family education and support. Option D. Focusing solely on pain management and comfort measures for the congenital scoliosis, while referring the clubfoot to a podiatrist for a one-time casting, assuming these are the only necessary interventions. The correct answer is C. Prioritizing a comprehensive assessment of the spinal curvature and foot deformity, followed by collaborative development of an individualized, evidence-based treatment plan that may include observation, bracing, physical therapy, and surgical intervention as indicated, with a strong emphasis on family education and support. Explanation. This scenario presents a professional challenge in orthopedic nursing due to the nuanced and evolving nature of congenital disorder management, specifically scoliosis and clubfoot. Differentiating between appropriate interventions requires a deep understanding of developmental milestones, surgical indications, and non-surgical management strategies, all within the context of patient-centered care and adherence to established orthopedic protocols. The challenge lies in tailoring care to individual patient needs, while ensuring compliance with best practices and regulatory guidelines for pediatric orthopedic care. Correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and evidence-based treatment planning. This aligns with the ethical imperative to provide individualized care and the regulatory expectation for nurses to practice within their scope, utilizing current knowledge and collaborating with specialists. It emphasizes early identification, appropriate referral, and the integration of family education, which are critical for optimal outcomes in congenital orthopedic conditions. This approach ensures that interventions are timely, evidence-based, and aligned with the patient's developmental stage and specific condition. An incorrect approach that focuses solely on immediate surgical correction without considering conservative options fails to adhere to the principle of least invasive intervention and may lead to unnecessary surgical risks and prolonged recovery. This could be considered a failure to practice evidence-based care and potentially violate guidelines that advocate for a staged approach to treatment. Another incorrect approach that relies on outdated or unverified treatment modalities ignores current best practices and may result in suboptimal outcomes or harm to the patient. This represents a failure to maintain professional competency and a potential breach of the duty of care, as nurses are expected to stay abreast of advancements in orthopedic nursing. A further incorrect approach that neglects comprehensive family education and support overlooks the crucial role of the family in the long-term management of congenital disorders. This can lead to poor adherence to treatment plans and increased patient and family distress, failing to meet the holistic care standards expected in nursing practice. The professional decision-making process for similar situations should involve a systematic assessment of the patient's condition, a thorough review of their medical history, and consultation with the orthopedic team. Nurses should critically evaluate available treatment options based on current evidence, patient-specific factors, and family preferences. Collaboration with physical therapists, genetic counselors, and other relevant healthcare professionals is essential to develop a holistic care plan. Adherence to institutional policies and professional nursing standards, coupled with ongoing professional development, will guide appropriate and ethical decision-making. Question 10. Risk assessment procedures indicate a patient recovering from a total knee arthroplasty reports a significant increase in pain and swelling in the operative limb, yet the initial physical examination reveals minimal erythema, stable vital signs, and no palpable warmth. The nurse suspects a potential complication, but is unsure how to proceed given the conflicting data. Which of the following actions is the most appropriate next step? Option A. Conduct a more detailed and targeted physical examination of the operative knee, including assessment of range of motion, palpation for crepitus, and evaluation of distal pulses and sensation, while also re-eliciting the patient's pain history with specific questions about onset, character, and aggravating/alleviating factors. Option B. Immediately notify the orthopedic surgeon of a suspected deep vein thrombosis, DVT, based on the patient's report of increased pain and swelling, without performing further assessment. Option C. Document the patient's subjective report of increased pain and swelling, but proceed with the scheduled routine post-operative care without further immediate investigation, as the objective findings are reassuring. Option D. Reassure the patient that the initial examination findings are normal and advise them to continue with their prescribed pain medication regimen as scheduled. The correct answer is A. Conduct a more detailed and targeted physical examination of the operative knee, including assessment of range of motion, palpation for crepitus, and evaluation of distal pulses and sensation, while also re-eliciting the patient's pain history with specific questions about onset, character, and aggravating/alleviating factors. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic nursing, where a patient's subjective report of pain and functional limitation conflicts with objective physical findings. The challenge lies in accurately interpreting this discrepancy to ensure appropriate and safe patient care, avoiding both undertreatment and overtreatment, and respecting the patient's experience while adhering to evidence-based practice. Correct approach analysis. The correct approach prioritizes a comprehensive and systematic reassessment of the patient's history and physical examination. This aligns with the fundamental principles of nursing practice, emphasizing thorough data collection and validation. Specifically, it adheres to the nursing process, assessment, diagnosis, planning, implementation, evaluation, by returning to the assessment phase to gather more precise information. This approach respects the patient's autonomy and subjective experience of pain, while also critically evaluating objective findings. It is ethically mandated to provide individualized care based on accurate data, and regulatory frameworks for nursing practice universally require nurses to conduct thorough assessments and document their findings meticulously. This systematic reevaluation ensures that any underlying causes for the discrepancy are identified, leading to a more accurate diagnosis and effective treatment plan. Incorrect approaches analysis. Failing to reevaluate the physical examination and solely relying on the initial findings, despite the patient's report of worsening symptoms, represents a failure to adapt care to the patient's evolving condition. This can lead to delayed diagnosis or inadequate pain management, potentially violating the nurse's duty of care and ethical obligations to alleviate suffering. It also disregards the patient's subjective report, which is a critical component of pain assessment. Dismissing the patient's subjective report of pain as potentially exaggerated or psychosomatic without further objective investigation is a significant ethical and professional failing. This approach can lead to patient distrust, undertreatment of pain, and a failure to identify serious underlying issues. It violates the principle of patient-centered care and can be considered discriminatory if based on assumptions rather than clinical data. Regulatory guidelines emphasize the importance of believing and thoroughly assessing patient-reported symptoms, focusing solely on the initial objective findings and assuming they are definitive, without considering the patient's current subjective experience, ignores the dynamic nature of orthopedic conditions. This can lead to a misdiagnosis or a failure to recognize complications. It demonstrates a lack of critical thinking and a failure to integrate all available data, which is a cornerstone of safe nursing practice and is often a requirement in nursing practice standards. Professional reasoning. When faced with a discrepancy between subjective patient reports and objective findings, the professional decision-making process should involve 1. Acknowledging and validating the patient's subjective experience. 2. Conducting a thorough and systematic reassessment of the relevant physical examination components. 3. Reevaluating the patient's history for any new or altered information. 4. Correlating the subjective and objective data, seeking clarification for any inconsistencies. 5. Consulting with the interdisciplinary team, including physicians, if the discrepancy cannot be resolved through reassessment. 6. Documenting all findings, interventions, and rationale meticulously. This iterative process ensures that patient care is based on the most current and accurate information available. Question 11. Investigation of a postoperative orthopedic patient's pain management reveals the following. The nurse notes a pain score of 7/10 on a numerical rating scale. The patient describes the pain as sharp and throbbing in the surgical site. The nurse administers the prescribed opioid analgesic. Later in the shift, the nurse documents patient pain managed without further detail. Which of the following represents the most appropriate and compliant approach to pain assessment and documentation in this scenario? Option A. Document the initial pain score and the administered medication, assuming the pain is controlled if the patient does not verbally complain further. Option B. Document only the initial pain score and the administered medication, as further documentation is only necessary if the pain score remains high. Option C. Document the initial pain score and the administered medication, and wait until the end of the shift to document the patient's overall pain status. Option D. Document the initial pain score, the patient's description of pain, the administered medication, and a reassessment of pain level and quality after the medication has had time to take effect. The correct answer is D. Document the initial pain score, the patient's description of pain, the administered medication, and a reassessment of pain level and quality after the medication has had time to take effect. Explanation. This scenario is professionally challenging because accurately assessing and documenting a patient's pain is fundamental to providing effective orthopedic care and is a core component of patient safety and quality improvement initiatives. The certified orthopedic nurse. Con. Must navigate the complexities of subjective pain reporting, the limitations of various assessment tools, and the legal and ethical imperative for precise and timely documentation. Failure to do so can lead to inadequate pain management, patient dissatisfaction, and potential legal repercussions. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and objective assessment of pain, utilizing validated tools and ensuring clear, concise, and timely documentation. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as regulatory requirements for accurate medical records. The chosen pain scale should be appropriate for the patient's cognitive status and condition, and the documentation should reflect not only the pain score, but also the patient's description of the pain, its location, quality, and any interventions and their effectiveness. This detailed approach ensures continuity of care and provides a clear audit trail for quality review and legal purposes. An incorrect approach that relies solely on a single, potentially inappropriate pain scale without further subjective or objective assessment fails to meet the standard of care. This could be a regulatory failure if it deviates from established hospital policies or professional nursing standards that mandate a thorough pain assessment. Ethically, it breaches the duty to provide competent care by potentially overlooking crucial aspects of the patient's pain experience. Another incorrect approach that involves vague or incomplete documentation, such as simply noting pain controlled without specifying the pain score, interventions, or patient response, is a significant documentation failure. This can lead to miscommunication among the healthcare team, delayed or inappropriate treatment adjustments, and can be viewed as a breach of professional responsibility and potentially a violation of healthcare record-keeping regulations. It also hinders the ability to track pain trends and evaluate the effectiveness of treatment plans. A third incorrect approach that involves delaying documentation until the end of the shift, especially for acute pain, poses a risk to patient safety. Pain is a dynamic experience, and immediate documentation allows for prompt intervention and reassessment. Delaying this can lead to prolonged suffering and missed opportunities to optimize pain management. This could be considered a failure to adhere to timely documentation standards, which are often stipulated in professional practice guidelines and regulatory frameworks aimed at ensuring patient safety. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Begin with a thorough subjective and objective assessment of the patient's pain, considering their condition, age, cognitive status, and any confounding factors. 2. Tool selection. Choose an appropriate pain assessment scale that is validated for the patient's population and condition. 3. Intervention and reassessment. Implement appropriate pain management interventions based on the assessment and reassess the patient's pain regularly and after interventions. 4. Documentation. Accurately and comprehensively document all findings, interventions, and patient responses in the medical record in a timely manner. 5. Communication. Communicate significant changes in pain or response to treatment to the interdisciplinary team. 6. Ethical and regulatory review. Ensure all actions and documentation comply with professional nursing standards, ethical principles, and relevant regulatory requirements. Question 12. Compliance review shows a patient, post-total knee arthroplasty, reports significant anterior thigh pain and difficulty extending the knee fully, stating it feels like my muscle is stuck. Objective assessment reveals intact sensation and motor function in the foot and ankle, and no gross swelling or erythema around the surgical site. The nurse notes mild tenderness on palpation of the quadriceps femoris muscle group. Considering the patient's symptoms and the initial objective findings, which of the following best guides the nurse's next steps in assessing the cause of the anterior thigh pain and perceived stickiness in knee extension? Option A. Administer a stronger analgesic and instruct the patient to rest the leg for 24 hours to allow the pain to subside before re-evaluating. Option B. Focus solely on the surgical incision site, checking for signs of infection or dehiscence, as this is the most likely source of post-operative pain. Option C. Reassure the patient that this is a common post-operative sensation, and advise them to focus on their prescribed physical therapy exercises without further immediate investigation. Option D. Palpate the quadriceps femoris muscle group more deeply, assessing for trigger points, facial restrictions, and potential muscle guarding, while also evaluating the origin and insertion points of the vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris to understand their biomechanical contribution to knee extension. The correct answer is D. Palpate the quadriceps femoris muscle group more deeply, assessing for trigger points, fascial restrictions, and potential muscle guarding, while also evaluating the origin and insertion points of the vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris to understand their biomechanical contribution to knee extension. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic nursing, where a patient's subjective report of pain and functional limitation may not immediately align with objective physical findings. The challenge lies in accurately assessing the underlying muscle physiology and anatomy to determine the cause of the patient's symptoms, ensuring appropriate intervention, and avoiding misdiagnosis or delayed treatment. The nurse must integrate knowledge of muscle function, potential pathologies, and patient reporting to provide effective care within the scope of practice. Correct approach analysis. The correct approach involves a systematic assessment that integrates the patient's subjective experience with objective findings. This includes a thorough history, observation of gait and posture, palpation for tenderness or spasm, and assessment of range of motion and muscle strength. Understanding the specific muscles involved in the reported pain and functional deficit, their innervation, and their biomechanical function is crucial. For example, if a patient reports difficulty with hip abduction, the nurse would consider the gluteus medius and minimus, their origin and insertion, and their role in stabilizing the pelvis. This comprehensive approach aligns with best professional practice by ensuring a holistic and evidence-based evaluation, leading to accurate diagnosis and targeted treatment, thereby upholding the standard of care expected of a certified orthopedic nurse. This adheres to the ethical principle of beneficence and non-maleficence by prioritizing patient well-being and avoiding harm through thorough assessment. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's subjective report of pain without performing a detailed physical examination. This fails to acknowledge the complexities of musculoskeletal pain and can lead to overlooking underlying structural or physiological issues. It also disregards the nurse's professional responsibility to conduct objective assessments as mandated by nursing practice standards. Another incorrect approach would be to dismiss the patient's symptoms based on seemingly normal objective findings without further investigation. This can occur if the nurse lacks a deep understanding of subtle muscle dysfunction or early-stage pathologies. Such an approach risks delaying necessary treatment and can be considered a failure to meet the standard of care, potentially violating principles of patient advocacy and diligent practice. A third incorrect approach would be to focus only on superficial muscle palpation without considering the deeper muscle groups, their facial connections, or referred pain patterns. This limited scope of assessment may miss the true source of the patient's discomfort and lead to ineffective intervention, failing to address the root cause of the problem, and thus not providing optimal patient care. Professional reasoning. When faced with a discrepancy between subjective and objective findings, a certified orthopedic nurse should employ a structured problem-solving process. This involves 1. Actively listening to and validating the patient's reported symptoms. 2. Conducting a comprehensive physical examination, systematically assessing relevant muscle groups, joints, and neurological function. 3. Applying knowledge of muscle anatomy and physiology to hypothesize potential causes for the symptoms. 4. Differentiating between common musculoskeletal conditions and more complex etiologies. 5. Collaborating with the interdisciplinary team, including physicians, physical therapists, and radiologists, when necessary. 6. Documenting all findings and interventions meticulously. This systematic and evidence-based approach ensures patient safety and optimal outcomes. Question 13. The audit findings indicate a significant variance in patient comprehension and safe utilization of prescribed mobility aids and assistive devices following discharge from orthopedic services. What is the most effective approach for the certified orthopedic nurse to address this educational deficit and ensure improved patient outcomes? Option A. Rely on the patient's verbal confirmation of understanding after a brief overview of the mobility aid's function, and encourage them to contact the clinic with any questions. Option B. Develop and implement a standardized, multimodal patient education program that includes hands-on demonstration, supervised practice, and clear, written instructions tailored to individual patient needs and learning styles, with a mechanism for follow-up assessment of comprehension. Option C. Delegate the primary responsibility for educating patients on mobility aid usage to physical therapy aides, with the certified orthopedic nurse providing only general oversight. Option D. Provide all patients with comprehensive written pamphlets detailing the use of various mobility aids and instruct them to review the materials thoroughly before discharge. Correct answer is B. Develop and implement a standardized, multimodal patient education program that includes hands-on demonstration, supervised practice, and clear, written instructions tailored to individual patient needs and learning styles, with a mechanism for follow-up assessment of comprehension. Explanation. Scenario analysis. This scenario presents a common implementation challenge in orthopedic nursing, ensuring consistent and effective patient education regarding mobility aids. The audit findings highlight a gap in patient understanding, which can lead to poor adherence, increased risk of falls, delayed recovery, and potential readmissions. The challenge lies in translating theoretical knowledge into practical, patient-centered education that accounts for individual learning styles, physical limitations, and home environments. The nurse must not only impart information, but also assess comprehension and provide ongoing support. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes individualized assessment and hands-on demonstration. This aligns with best professional practice by ensuring that education is tailored to the patient's specific needs and learning capacity. Regulatory frameworks for nursing practice, such as those outlined by the Orthopedic Nursing Certification Board, ONC, and relevant state nursing practice acts, assuming U.S. jurisdiction for this exam, emphasize patient advocacy, safe practice, and effective communication. A comprehensive approach that includes assessing the patient's current understanding, demonstrating proper use of the device, allowing supervised practice, and providing clear, written instructions with follow-up is crucial for promoting patient safety and optimal outcomes. This approach directly addresses the audit findings by moving beyond passive information delivery to active skill acquisition and comprehension verification. Incorrect approach is analysis. Providing only written materials fails to account for varying literacy levels, cognitive abilities, or the need for kinesthetic learning. This approach risks non-compliance and misunderstanding, potentially violating the nursing duty to provide adequate patient education and ensure patient safety, which are core tenets of professional nursing standards and regulatory guidelines. Relying solely on the patient's self-reported understanding is insufficient, as patients may overestimate their comprehension due to a desire to please or a lack of awareness of their own knowledge gaps. This can lead to unsafe practices and adverse events, contravening the principle of patient well-being and the nurse's responsibility for accurate assessment. Delegating the entire education process to unlicensed assistive personnel without direct nursing oversight can lead to inconsistent or incomplete information delivery, potentially violating regulations regarding the scope of practice for assistive personnel and the nurse's ultimate accountability for patient education. Assuming all patients will understand verbal instructions without visual aids or demonstration overlooks diverse learning styles and potential communication barriers, increasing the risk of error and non-adherence, which is contrary to the nursing standard of care. Professional reasoning. When faced with an implementation challenge like inconsistent patient education, a professional nurse should employ a systematic approach. First, acknowledge the audit findings and the potential impact on patient care. Second, review current educational protocols and identify specific areas of weakness. Third, develop and implement a revised educational strategy that incorporates individualized assessment, demonstration, supervised practice, and clear multimodal communication, verbal, written, visual. Fourth, establish a system for ongoing evaluation of patient comprehension and provide opportunities for questions and reinforcement. Finally, document all educational interventions and patient responses thoroughly. This decision-making process prioritizes patient safety, promotes adherence, and ensures compliance with professional standards and regulatory requirements. Question 14. Risk assessment procedures indicate that a patient prescribed a new opioid analgesic for postoperative orthopedic pain is reporting increased dizziness and a feeling of lightheadedness, which were not present prior to the medication. The patient expresses a strong desire for continued pain relief. As a certified orthopedic nurse, what is the most appropriate immediate action? Option A. withhold the medication. Perform a focused assessment of the patient's vital signs and neurological status, and contact the prescribing physician to report the observed symptoms and discuss potential alternatives or dosage adjustments. Option B. Administer the prescribed opioid analgesic as ordered, reassuring the patient that these sensations are common and will likely subside. Option C. Ask a more experienced orthopedic nurse colleague for their opinion on managing opioid-induced dizziness before taking any further action. Option D. Advise the patient to rest and avoid any sudden movements, assuring them that the dizziness is temporary and will resolve on its own without further medical intervention. The correct answer is B. Administer the prescribed opioid analgesic as ordered, reassuring the patient that these sensations are common and will likely subside. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire for pain relief and the nurse's responsibility to administer medications safely and ethically, considering potential adverse effects and contraindications. The nurse must balance patient autonomy with the duty of beneficence and non-maleficence, requiring careful assessment and communication. The certified orthopedic nurse (CON) role necessitates a deep understanding of orthopedic medications, their side effects, and contraindications to ensure patient safety and optimal outcomes within the established regulatory framework. Correct approach analysis. The correct approach involves a thorough assessment of the patient's current condition, including vital signs, pain level, and any pre-existing conditions or allergies that might contraindicate the prescribed medication. This aligns with the fundamental principles of nursing practice and the ethical guidelines governing healthcare professionals, emphasizing patient safety and evidence-based care. Specifically, it adheres to the regulatory framework that mandates nurses to assess patients before administering medications, identify potential risks, and communicate these risks to both the patient and the prescribing physician. This proactive approach ensures that the medication is appropriate for the patient's current status and minimizes the risk of adverse drug events, upholding the standard of care expected of a CON. Incorrect approach is analysis. Administering the medication without further assessment, assuming the physician's prescription is always appropriate, represents a failure to uphold the nurse's professional responsibility to assess and monitor patient responses. This bypasses critical safety checks and could lead to serious adverse drug reactions, violating the principle of non-maleficence and potentially contravening regulations that require nurses to exercise independent judgment in patient care. Consulting only with a colleague without directly assessing the patient or communicating with the physician demonstrates a lack of direct patient advocacy and a failure to engage with the primary prescriber. While peer consultation can be valuable, it should supplement, not replace, direct patient assessment and physician communication when a potential issue arises. This approach risks delaying necessary interventions and may not fully address the specific patient's needs or the nuances of the medication's contraindications. Focusing solely on the patient's request for pain relief without considering the medication's potential side effects or contraindications prioritizes patient comfort over safety. This approach neglects the nurse's ethical and legal obligation to prevent harm and administer medications judiciously. It fails to recognize that immediate pain relief might be outweighed by the risk of a more severe adverse event, a critical consideration for any CON. Professional reasoning. When faced with a situation where a prescribed medication may have potential side effects or contraindications for a specific patient, a CON should follow a systematic decision-making process. This process begins with a comprehensive patient assessment, including a review of their medical history, current medications, allergies, and vital signs. Following assessment, the nurse must consult the medication's prescribing information to identify known side effects and contraindications relevant to the patient's profile. If concerns arise, the next critical step is to communicate these concerns clearly and concisely to the prescribing physician, providing specific patient data to support the assessment. This collaborative approach ensures that the patient receives the most appropriate and safest treatment plan, upholding professional standards and regulatory requirements. Question 15. The analysis reveals that a patient diagnosed with severe osteoporosis expresses a strong desire to continue a specific supplement regimen they read about online, despite the orthopedic nurse's assessment indicating it is not evidence-based and may interact negatively with prescribed medications. The patient insists this supplement is the key to reversing their bone density loss. Which of the following represents the most appropriate professional nursing approach in this situation? Option A. Agree to the patient's request to continue the supplement regimen as a gesture of goodwill, while continuing to administer the prescribed medications, and hope that the supplement does not cause harm. Option B. Immediately discontinue the discussion and document the patient's request, informing the physician that the patient is refusing to adhere to the prescribed treatment plan due to misinformation. Option C. Engage in a detailed, empathetic discussion with the patient to understand their concerns, provide evidence-based information about osteoporosis management and the potential risks and benefits of their preferred supplement, and collaboratively explore alternative or complementary strategies that align with current orthopedic nursing guidelines. Option D. Firmly explain to the patient that their online research is incorrect and that they must strictly follow the prescribed medication regimen without deviation, as this is the only effective treatment. The correct answer is C. Engage in a detailed, empathetic discussion with the patient to understand their concerns, provide evidence-based information about osteoporosis management and the potential risks and benefits of their preferred supplement, and collaboratively explore alternative or complementary strategies that align with current orthopedic nursing guidelines. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire for a specific treatment and the nurse's professional judgment regarding the most appropriate and evidence-based care for their degenerative bone disease. The patient's misinformation about treatment efficacy and potential risks, coupled with their strong emotional attachment to a particular therapy, necessitates a delicate balance of patient autonomy, beneficence, and non-maleficence. The nurse must navigate this situation while adhering to professional standards of care and ethical guidelines for orthopedic nursing practice. Correct approach analysis. The correct approach involves a comprehensive and empathetic discussion with the patient, focusing on education and shared decision-making. This aligns with the ethical principles of patient autonomy, ensuring the patient has the information necessary to make informed choices about their care. It also upholds the principle of beneficence by advocating for treatments supported by current orthopedic nursing guidelines and evidence-based practice, which are paramount in managing degenerative diseases like osteoporosis and osteomalacia. The nurse's role is to clarify misconceptions, present scientifically validated treatment options, discuss potential benefits and risks objectively, and collaboratively develop a care plan that respects the patient's values and preferences while prioritizing their well-being and safety. This approach is consistent with the regulatory framework for nursing practice, which mandates competent and ethical care. Incorrect approaches analysis. One incorrect approach involves immediately deferring to the patient's stated preference without further investigation or education. This fails to uphold the nurse's professional responsibility to ensure patient safety and provide evidence-based care. It could lead to the patient pursuing ineffective or potentially harmful treatments, violating the principle of non-maleficence and potentially contravening regulatory requirements for providing competent nursing care. Another incorrect approach is to dismiss the patient's concerns and rigidly insist on a prescribed treatment plan without acknowledging their input or addressing their misinformation. This disregards patient autonomy and can erode trust, hindering the therapeutic relationship. It also fails to meet the ethical obligation to communicate effectively and empathetically with patients, which is a cornerstone of professional nursing practice. A third incorrect approach might be to simply document the patient's request without actively engaging in a discussion or seeking to clarify the situation. This passive stance abdicates the nurse's responsibility to advocate for the patient's best interests and to ensure they are adequately informed about their condition and treatment options. It could be seen as a failure to meet the standard of care expected in orthopedic nursing. Professional reasoning. Professionals should approach such dilemmas by first actively listening to the patient to understand their perspective and the source of their information. This should be followed by a thorough assessment of the patient's understanding of their condition and treatment options. The next step involves providing clear, accurate, and evidence-based information about degenerative bone diseases and their management, addressing any misconceptions directly and respectfully. The nurse should then facilitate a collaborative discussion about treatment goals and options, empowering the patient to participate in shared decision-making. If disagreements persist, consulting with the orthopedic physician or a multidisciplinary team can provide additional support and ensure the most appropriate care plan is established. Question 16. The risk matrix shows a patient presenting with significant pain and limited ability to move their arm away from their torso while maintaining their elbow in a flexed position. Based on the principles of orthopedic nursing and the understanding of joint types and their movements, which of the following best describes the primary joint and movement limitation observed? Option A. The humeral-ulnar joint is exhibiting limited extension. Option B. The scapulothoracic joint is exhibiting limited protraction. Option C. The elbow joint is exhibiting limited flexion. Option D. The glenohumeral joint is exhibiting limited abduction. Correct answer is D. The glenohumeral joint is exhibiting limited abduction. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the orthopedic nurse to accurately identify the type of joint and its associated movements in a patient presenting with a specific functional limitation. Misidentification can lead to inappropriate treatment plans, delayed recovery, and potential patient harm. The challenge lies in translating a clinical observation into precise anatomical and biomechanical terminology, which is fundamental to effective orthopedic care. Correct approach analysis. The correct approach involves recognizing that the patient's inability to move their arm away from their body while maintaining elbow flexion directly corresponds to a limitation in abduction at the glenohumeral shoulder joint. This joint is a ball and socket type, allowing for a wide range of motion including flexion, extension, abduction, adduction, rotation, and circumduction. The observed deficit specifically points to impaired abduction. This aligns with the regulatory framework for orthopedic nursing, which mandates accurate patient assessment and the application of appropriate anatomical and physiological knowledge to guide care. Best professional practice dictates that nurses utilize precise terminology to ensure clear communication among the healthcare team and to develop targeted interventions. Incorrect approaches analysis. One incorrect approach would be to broadly categorize the movement as arm movement without specifying the joint or the type of motion. This lacks the precision required by orthopedic nursing standards and regulatory guidelines, which emphasize detailed and accurate documentation. It fails to identify the specific joint, glenohumeral, or the type of movement, abduction, that is impaired, hindering effective problem solving. Another incorrect approach would be to focus solely on the elbow flexion, implying the issue is with the elbow joint. While elbow flexion is present, the described limitation is in moving the arm away from the body, which is a shoulder movement. This demonstrates a failure to differentiate between the actions of different joints and their respective ranges of motion, a core competency for an orthopedic nurse. This misattribution could lead to interventions targeting the wrong joint, delaying appropriate treatment for the shoulder. A third incorrect approach might involve identifying the movement as rotation without further qualification. While rotation is a movement of the shoulder, the described action of moving the arm away from the body is abduction, not rotation. This shows a misunderstanding of the distinct types of movements possible at a synovial joint, which is a fundamental aspect of orthopedic assessment. Professional reasoning. When faced with a patient presenting with a specific functional deficit, the orthopedic nurse must employ a systematic approach. This involves 1. Observing the patient's movement or lack thereof. 2. Identifying the specific body part and joint involved. 3. Differentiating the type of movement being attempted or restricted. 4. Recalling the anatomical classification of the joint and its normal range of motion. 5. Applying this knowledge to the observed deficit to formulate an accurate assessment and plan of care. This process ensures adherence to professional standards of practice and regulatory requirements for competent patient care. Question 17. Research into the most effective and comprehensive assessment techniques for a post-operative orthopedic patient experiencing moderate pain and limited mobility. What approach best integrates subjective patient reporting with objective clinical findings to guide immediate nursing interventions? Option A. Relying solely on the patient's verbal description of pain and observing their ability to move the limb without assistance. Option B. Focusing exclusively on passive range of motion exercises to maximize joint mobility, regardless of the patient's pain reports. Option C. Encouraging immediate ambulation to promote circulation and prevent stiffness, without a detailed preambulation assessment of pain or stability. Option D. administering a visual analog scale for pain intensity, performing passive range of motion exercises for the affected limb, and palpating for joint effusion and tenderness. The correct answer is D. Administering a visual analog scale for pain intensity, performing passive range of motion exercises for the affected limb, and palpating for joint effusion and tenderness. Explanation. This scenario presents a common challenge in orthopedic nursing: the need to accurately assess a patient's pain and functional status following a surgical intervention, while also ensuring patient comfort and safety. The challenge lies in balancing the objective measurement of physical findings with the subjective experience of pain, and in selecting assessment techniques that are both effective and minimally disruptive to the patient's recovery. Careful judgment is required to interpret findings, identify potential complications, and tailor interventions to the individual patient's needs and response. The correct approach represents best professional practice because it integrates multiple, validated assessment techniques to provide a comprehensive picture of the patient's orthopedic status. This aligns with the principles of evidence-based practice, which is a cornerstone of professional nursing care. Specifically, utilizing a combination of visual analog scales, VAS, for pain intensity, range of motion ROM, measurements to objectively assess joint mobility, and palpation to identify swelling or tenderness, allows for a multidimensional evaluation. This approach respects the patient's subjective report of pain, while also gathering objective data to corroborate or contextualize it. Adherence to established nursing standards of care, as often outlined by professional organizations and institutional policies, mandates such thorough and systematic assessments to ensure patient safety and optimal outcomes. An incorrect approach that relies solely on verbal pain reports without objective physical assessment fails to meet the standard of care. This is because subjective pain can be influenced by numerous factors, and without objective correlates, it may be difficult to accurately gauge the underlying physiological issue or the effectiveness of interventions. This could lead to under- or overtreatment of pain, potentially masking or exacerbating underlying orthopedic problems. Ethically, this approach could be seen as a failure to provide competent care, as it neglects crucial objective data. Another incorrect approach that focuses exclusively on passive range of motion without considering the patient's pain response is also professionally unacceptable. While ROM is important, forcing movement that elicits significant pain can cause further tissue damage, increase inflammation, and impede healing. This disregards the patient's immediate comfort and safety, violating the ethical principle of non-maleficence, do no harm. Furthermore, it fails to acknowledge the crucial interplay between pain and mobility in orthopedic recovery. A third incorrect approach that prioritizes immediate ambulation over a thorough pre-ambulation assessment, including pain and stability, is dangerous. This could lead to falls, re-injury, or increased surgical site complications. It bypasses essential safety checks and neglects the patient's readiness for such activity, representing a significant lapse in professional judgment and a failure to adhere to safe patient handling protocols. This approach directly contravenes the ethical imperative to protect the patient from harm. The professional decision-making process for similar situations should involve a systematic approach. First, understanding the patient's baseline and the specific orthopedic condition or surgical procedure. Second, selecting appropriate, evidence-based assessment tools that address both subjective and objective parameters. Third, performing the assessment in a manner that is sensitive to the patient's comfort and pain levels. Fourth, interpreting the collected data in the context of the patient's overall condition and expected recovery trajectory. Finally, using this comprehensive assessment to inform and adjust the nursing care plan, ensuring patient safety, comfort, and optimal functional recovery, while always adhering to professional standards and ethical obligations. Question 18. Examination of the data shows a 68-year-old female patient with a diagnosis of rheumatoid arthritis, currently prescribed methotrexate, prednisone 5 mg daily, and ibuprofen 400 mg PRN for breakthrough pain. She reports a significant increase in joint pain and stiffness over the past 48 hours, rated 7/10, and states she has taken ibuprofen 3 times yesterday and twice today. She denies fever, swelling, or redness in the affected joints. What is the most appropriate initial nursing action? Option A. Assess the patient's pain, review her medication adherence, and contact the physician to report the change in symptoms and pain level. Option B. Administer a PRN dose of prednisone as ordered for symptom exacerbation. Option C. Advise the patient to increase her daily ibuprofen dose to 600 mg every 6 hours. Option D. Reassure the patient that increased pain is a common occurrence with rheumatoid arthritis and encourage rest. The correct answer is B. Administer a PRN dose of prednisone as ordered for symptom exacerbation. Explanation. This scenario presents a common clinical challenge involving a patient with rheumatoid arthritis experiencing a flare-up. The nurse must assess the patient's current medication regimen, understand the mechanisms of action and potential side effects of NSAID, corticosteroids, and DMARD, and determine the most appropriate nursing intervention. The professional challenge lies in balancing the need for symptom relief with the potential risks associated with these medications, particularly in a patient with pre-existing conditions or contraindications. Careful judgment is required to prioritize patient safety and optimize therapeutic outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's current status and medication adherence before initiating any changes or interventions. This aligns with the fundamental nursing principle of patient-centered care and evidence-based practice. Specifically, it adheres to regulatory frameworks that mandate thorough patient evaluation, accurate medication reconciliation, and the reporting of adverse events or significant changes in patient condition to the prescribing physician. Ethical considerations also support this approach, emphasizing the nurse's responsibility to advocate for the patient and ensure their safety by understanding the full clinical picture. An incorrect approach that involves immediately administering a PRN dose of a corticosteroid without a physician's order or further assessment fails to adhere to the scope of nursing practice and physician's orders. This could lead to inappropriate dosing, masking of underlying issues, or adverse drug reactions, violating regulations regarding medication administration and patient safety. Another incorrect approach, such as advising the patient to simply increase their NSAID dose independently, bypasses the physician's role in medication management and could result in gastrointestinal distress, renal impairment, or other serious side effects, contravening guidelines on medication safety and physician oversight. Finally, an approach that dismisses the patient's reported pain as a normal part of their condition without further investigation ignores the potential for medication ineffectiveness, disease progression, or other complications, which is a failure in professional duty of care and patient assessment. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient thoroughly, including vital signs, pain level, and any new symptoms. 2. Review the patient's current medication list, including prescribed doses, frequency, and adherence. 3. Understand the indications, contraindications, and potential side effects of all prescribed medications. 4. Consult the physician or advanced practice provider for any necessary adjustments to the treatment plan, especially when there are significant changes in the patient's condition or reported symptoms. 5. Educate the patient about their medications and when to seek medical attention. Question 19. Market research demonstrates that orthopedic rehabilitation outcomes are significantly influenced by the precision of initial and ongoing functional assessments. A certified orthopedic nurse is caring for a patient 48 hours post-total knee arthroplasty. Which of the following approaches to assessing the patient's lower extremity function best aligns with current best practices for objective measurement and documentation? Option A. Relying on the patient's subjective report of pain levels and their perceived ability to ambulate short distances. Option B. Utilizing goniometry to measure active and passive range of motion and performing manual muscle testing to grade muscle strength. Option C. Observing the patient's gait pattern and asking them to describe their comfort with various daily activities. Option D. Asking the patient to perform a series of functional tasks, such as standing up from a chair and noting the time taken. The correct answer is B. Utilizing goniometry to measure active and passive range of motion and performing manual muscle testing to grade muscle strength. Explanation. This scenario presents a professional challenge in accurately and consistently assessing a patient's functional capacity following orthopedic surgery. The challenge lies in selecting and applying appropriate assessment tools that are both reliable and valid, ensuring that the data collected is meaningful for treatment planning and progress monitoring. The certified orthopedic nurse must navigate the nuances of different assessment methodologies to provide optimal patient care within the established regulatory framework. The correct approach represents best professional practice because it prioritizes the use of standardized, evidence-based functional assessment tools, specifically employing a combination of goniometry for objective range of motion (ROM) measurements and manual muscle testing (MMT) for graded strength assessment provides a comprehensive and quantifiable baseline. This aligns with the ethical imperative to provide competent care and the regulatory expectation to document patient progress accurately. These tools, when used correctly, offer objective data that can be compared over time and against established norms, facilitating informed clinical decision-making and communication among the healthcare team. Adherence to these standardized methods ensures that patient care is not based on subjective impressions, but on measurable outcomes, which is crucial for patient safety and effective rehabilitation. An incorrect approach that relies solely on subjective patient reports of pain and perceived ability to perform activities of daily living fails to meet the standards of objective assessment. This approach is ethically problematic as it risks misinterpreting the patient's functional status, potentially leading to inappropriate treatment modifications or delayed recovery. From a regulatory perspective, it lacks the quantifiable data required for proper documentation and justification of care, potentially violating standards for record-keeping and evidence-based practice. Another incorrect approach that focuses only on visual observation of gait without standardized measurement tools is also professionally deficient. While visual observation is a component of assessment, it is inherently subjective and prone to observer bias. Without objective measures of ROM or strength, the nurse cannot accurately track subtle improvements or declines, nor can they reliably compare the patient's progress to established benchmarks. This can lead to an incomplete understanding of the patient's functional deficits and hinder the development of a targeted and effective rehabilitation plan, potentially contravening professional standards for comprehensive patient evaluation. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the patient's specific orthopedic condition and surgical intervention. 2. Consult current evidence-based practice guidelines and institutional protocols for post-operative orthopedic care. 3. Select appropriate, validated functional assessment tools that directly measure the relevant parameters, e.g., ROM, strength, pain, functional mobility. 4. Ensure proficiency in the administration and interpretation of the chosen assessment tools. 5. Document findings objectively and quantitatively, noting any limitations or influencing factors. 6. Integrate assessment data with patient-reported outcomes and clinical observations to develop and adjust the care plan. 7. Communicate findings clearly and concisely to the interdisciplinary team. Question 20. To address the challenge of a patient presenting with a new, palpable mass on their femur accompanied by increasing, persistent pain, which approach best ensures optimal patient care and adherence to professional standards for orthopedic nursing? Option A. Advise the patient to monitor the mass for any changes and return if the pain becomes unbearable, without immediate further medical investigation. Option B. Reassure the patient that most bone masses are benign and focus primarily on pain management until the symptoms significantly worsen. Option C. Initiate a comprehensive diagnostic workup including advanced imaging and consider a biopsy, while providing supportive care and patient education regarding the diagnostic process and potential findings. Option D. Rely on palpation and the patient's description of pain to determine if the mass is likely benign or malignant, and advise home care. The correct answer is C. Initiate a comprehensive diagnostic workup including advanced imaging and consider a biopsy, while providing supportive care and patient education regarding the diagnostic process and potential findings. Explanation. Scenario analysis. This scenario is professionally challenging due to the critical nature of distinguishing between benign and malignant musculoskeletal tumors. Misidentification can lead to delayed or inappropriate treatment, significantly impacting patient outcomes, including prognosis, quality of life, and survival. The orthopedic nurse must possess a high level of clinical judgment and understanding of tumor characteristics to advocate effectively for the patient and ensure timely, accurate diagnostic pathways are followed. The complexity arises from the varied presentations of these tumors, the potential for subtle but significant differences in clinical signs, and the emotional distress experienced by patients and their families. Correct approach analysis. The correct approach involves a comprehensive assessment that prioritizes obtaining a definitive diagnosis through appropriate imaging and biopsy, followed by consultation with a multidisciplinary team. This aligns with best professional practice and regulatory guidelines for patient care, which mandate evidence-based practice and patient advocacy. Specifically, orthopedic nursing standards of practice emphasize the nurse's role in facilitating diagnostic processes, educating patients, and collaborating with the healthcare team. Regulatory frameworks, such as those governing nursing scope of practice and patient rights, underscore the nurse's responsibility to ensure patients receive timely and accurate diagnoses and treatments. This approach upholds the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm by ensuring correct diagnosis and treatment. Incorrect approaches analysis. One incorrect approach involves relying solely on palpation and patient-reported pain to determine the nature of a bone lesion. This is a significant regulatory and ethical failure because it bypasses established diagnostic protocols and relies on subjective and potentially misleading information. Musculoskeletal tumors, both benign and malignant, can present with similar symptoms, and palpation alone is insufficient for differentiation. This approach violates the principle of evidence-based practice and could lead to delayed diagnosis of a malignant tumor, directly causing harm, violating non-maleficence. Another incorrect approach is to reassure the patient that the lump is likely benign without further investigation, based on a superficial assessment. This is professionally unacceptable as it constitutes premature closure of the diagnostic process and can create a false sense of security, leading to delayed presentation if the lesion is indeed malignant. This failure to pursue definitive diagnosis is a breach of professional duty and ethical responsibility to advocate for the patient's well-being. It also fails to meet the regulatory requirement for nurses to identify and report changes in patient condition that may require further medical intervention. A third incorrect approach is to focus solely on pain management without actively pursuing the underlying cause of the swelling and pain. While pain management is a crucial aspect of orthopedic nursing care, it should not supersede the investigation of a potentially serious underlying pathology. This approach neglects the nurse's responsibility to identify and address the root cause of the patient's symptoms, which is a fundamental aspect of holistic patient care and a requirement within nursing practice standards. It risks masking symptoms of a serious condition, delaying diagnosis and treatment, and thus violating the principles of beneficence and non-maleficence. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with recognizing the potential seriousness of a new or changing musculoskeletal mass. This involves a thorough patient history, including onset, duration, and characteristics of symptoms, followed by a comprehensive physical examination. Crucially, this assessment should trigger the appropriate diagnostic pathway, which typically includes advanced imaging, X-ray, MRI, CT scan, and if indicated, a biopsy for definitive histological diagnosis. The nurse's role is to facilitate this process, educate the patient about each step, and advocate for timely referrals to specialists. Collaboration with radiologists, pathologists, and orthopedic oncologists is essential. The framework emphasizes continuous assessment, patient education, and proactive intervention based on clinical findings and diagnostic results, always prioritizing patient safety and optimal outcomes within the established regulatory and ethical guidelines.